The muscular system, part 1. Our muscles can be grouped according to the way that they work. There are 3 types of muscle: skeletal or voluntary muscles that are under our control, smooth or involuntary muscles which work without us being aware of them, and cardiac or heart muscle, which is a special type of involuntary muscle which works without tiring. Let's now look at the main muscles of the upper body, including their main movements, starting with the pectoralis major. The pectoralis major originates from the clavicle and sternum and inserts into the humerus. The pectoralis major primarily adducts the arm through the transverse plane. They are also involved in deep breathing. The biceps brachii. The biceps brachii originate from the scapula and insert into the radius. The biceps brachii flex the arm through the sagittal plane and also supinates the arm through the transverse plane. The deltoids. The deltoids originate from the scapula and clavicle and insert into the humerus. The deltoids are responsible for moving the arm in all directions. The latissimus dorsi. The latissimus dorsi originates from the thoracic and lumbar vertebrae, as well as the sacrum, scapula, and lower ribs. The latissimus dorsi is the main muscle of the upper back. It is mainly responsible for arm adduction through the frontal plane and extension of the arm through the sagittal plane. The trapezius. The trapezius originates from the skull as well as the cervical and thoracic vertebrae and inserts into the scapula. The trapezius helps to control the movements of the shoulder girdle, which is considered the most mobile joint of the body. The rhomboids group. The rhomboids group originate from the thoracic and cervical vertebrae and insert into the scapula. The rhomboids group are primarily responsible for scapular retraction and elevation. The triceps brachii. The triceps brachii originate from the scapula and insert into the ulna. The triceps brachii extend the forearm at the elbow through the sagittal plane, and they also extend the arm at the shoulder. Let's now consider the main muscles of the torso and their main movements, starting with the abdominals. The abdominals support the lower back and control the position of the pelvis. The abdominals are involved in a number of torso movements as well as stabilization of the pelvis. The abdominal group consists of 2 superficial muscles, which include the rectus abdominis and the external oblique. The rectus abdominis is primarily involved in trunk flexion through the sagittal plane. The external oblique is primarily involved in trunk flexion through the sagittal plane, lateral flexion through the frontal plane, and rotation through the transverse plane. The deeper muscles of the abdominals group include the internal oblique, which performs the same roles as the external oblique, and the transverse abdominis. The transverse abdominis is the deepest muscle of the abdominal group and is primarily responsible for increasing intra-abdominal pressure, which stabilizes the pelvis and supports the lower back. The erectus spinae group. The erectus spinae group, also known as the lower back, is primarily responsible for trunk extension through the sagittal plane and lateral flexion through the frontal plane. Let's now consider the main muscles of the lower body and their main movements, starting with the quadriceps. The quadriceps consists of 4 main muscles grouped on the anterior thigh. The quadriceps originate from the pelvic girdle and femur and insert into the tibia. The quadriceps are collectively responsible for extending the knee joint and flexing the hip joint, with both movements occurring through the sagittal plane. The gluteus maximus. The gluteus maximus originates from the pelvic girdle and inserts into the femur and the iliotibial tract. The gluteus maximus extends the hip joint through the sagittal plane. In addition, the gluteus maximus is used when walking, particularly when taking long strides and climbing stairs. The gluteus medius and minimus are deep to the gluteus maximus, and both originate from the pelvic girdle and insert into the femur. The gluteus medius and minimus abduct the hip joint through the frontal plane and are used in walking by steadying the pelvis when one leg is off the ground. The hamstrings. The hamstrings are a group of muscles found on the posterior thigh. The hamstrings collectively originate from the pelvic girdle and insert into the tibia and fibula. The hamstrings extend the hip joint and flex the knee joint, both through the sagittal plane. The adductor group. The adductor group, also known as the groin muscles, originate from the pelvic girdle and insert into the femur. The adductor group is primarily responsible for adduction of the hip through the frontal plane. The 2 main muscles that make up the calf group are the gastrocnemius and the soleus. The gastrocnemius originates from the femur and inserts into the calcaneus or heel bone. The soleus originates from the tibia and fibula and inserts into the calcaneus. The gastrocnemius is primarily responsible for flexing the knee joint and plantarflexing the ankle joint through the sagittal plane. The soleus also plantarflexes the ankle joint through the sagittal plane.